Assalamu alaikum, the communication day. First scenario, you are the medical registrar. Mr. Ahmed, 62 years old man, has been investigated for progressive muscle weakness and difficulty of swallowing. Neurology have confirmed a diagnosis of motor neuron disease. You are asked to speak with his son, Daniel, who is waiting outside. Your tasks are explain diagnosis of motor neuron disease sensitively, discuss its implication, explain the feeding problems the patient is developing, seek consent or agreement toward best interest decision for a big tube. Ready?
Yes.
Yes, here you go.
Hello.
Hi, doctor.
I'm Dr. Ahmed, one of the doctors on the service today. Are you Mr. Daniel, the son of Mr. Ahmed, 62 years old?
Yes, doctor.
We are here to discuss about your father health condition. Is that okay with you?
Okay, doctor. Yeah, it's okay.
I believe that you are the next of kin of Mr. Ahmed.
Yes, I am, doctor.
Yeah, and I believe also it's okay with Mr. Ahmed. It's okay with Mr. Ahmed to take with you to talk to speak about him. Is that okay?
Yeah, it's okay. It's okay.
Before we start to talk about this issue, could you tell me, please, what do you know about your father's health condition?
Actually, for a couple of months now, my father has been having this progressive body weakness, and it is getting worse by the day. Of recent, he started having difficulty in eating, and I'm so worried. And that's why I'm wanting to see. He came here and they did some tests, and I don't know what's going on with my dad, doctor. I don't know.
Yeah, appreciate your worries, Mr. Daniel. We are here to discuss about all these issues. Do you have any specific expectation regarding this result of investigation done for your father?
I just want my father to get well, doctor.
What?
I just want my father to get well.
Yeah. Mr. Daniel, thank you for sharing that with me. Yeah, as you mentioned to me that your father have some tests, and we ran for him some investigation to see what is the cause of his behind this weakness he was suffering of. And the result is now with me, but I'm sorry to tell you, it's not as we hope, Mr. Daniel. Your father had been diagnosed with a condition called motor neuron disease. Have you ever heard about it before?
No, doctor. Is that something that is very bad?
Yeah, I highly appreciate your worries, Mr. Daniel. I will explain all for you. This condition, it's a medical condition that when there is progressive or it's progressive condition that affecting the nerves of your father and leads to weakness in the group of muscles in his body. And it's with the time it will progress and become worse. Sorry for this, Mr. Daniel. The condition, it's appear like your father expressed that he has some weakness in his body, and then it will be progressed to be difficulty of swallowing also, and also maybe difficulty of breathing either, Mr. Daniel. Are you following me?
Oh no. Does that mean my father is going to die very soon?
Yeah, I understand your worries, Mr. Daniel. It's not that he will die soon, but it's the condition. I'm sorry to tell you, it's progressive condition, and there is no cure for this condition. But it's different from one to other. But it's no treatment for this condition. I'm sorry for that. But for sure, we will not let your father suffering this alone. We are here to give him all the support he needs, and we will be beside him all through his journey, Mr. Daniel. For sure, we are here to give all the support. So don't worry regarding this.
Okay. So, doctor, what's the next plan now, my dad?
Yeah, your father will be treated under a group of specialty. It will be under the nerve doctors, the team responsible for breathing, the team responsible for specialized nurse also, the group of team that he will bring all the support your father need. And one of the management plan for him will start with him some medication taken by mouth at the beginning, and maybe after that, if there is any progression and he will start to suffering from difficulty of feeding or difficulty of breathing, we will offer for him another options to try to help him regard this. And regarding the feeding, did your father start to feel any difficulty of swallowing right now?
Yes, doctor. I said it for the past few weeks now. Whenever I give him food, he sometimes choke, and I'm worried about it, doctor. I'm so worried. I'm so worried.
Yeah, I understand your worries, Mr. Daniel. Yeah, regarding this disease is progress and it will affect the swallowing muscle also. I'm sorry for that. Sometimes some people start to complain of that type of shocking, and this shocking can lead to serious complication if it's continuous. Like this food particles will go to the lungs, and that cause severe infection for father, and it will deteriorate the condition. That's why we need to protect your father from getting this all serious complication. So our team decided for him what we called it. It's a minor surgery, minor procedure to protect his feeding and to prevent all this complication to be happening. This procedure called percutaneous endoscopic gastrostomy. Have you ever heard about it before?
No, doctor. What does it
Yeah.
do?
Okay, understand. I can explain for you more. This type of minor procedure, it's done under it's done by specialized team who did this procedure many times before, and expert team. They will just prepare your father by running some blood tests before doing this procedure to be sure that he is fit for this procedure, and then and they will numb him and maybe give him some like medication, let him a little bit sleepy. And there is a tube connected with a camera will introduce through his mouth or his nose through the food pipe and to reach the stomach. From there, they will just make a small what we call it hole or opening, small opening, and what tube through his tummy wall. Are you following me?
Yes, doctor. I'm following you,
Yeah, and
doctor.
through this tube, it will be inserted to his tummy wall to the stomach. He will get his feeding from there. And before he's just go from hospital, we will sit with a specialized nurse to train you and train your father also how to deal with this tube and how to keep it safe and how to get feeding through this tube.
2 minutes
Is that
left.
okay?
That's okay, but doctor, I'm a bit scared, doctor. You know, the way you explain it, I'm a bit scared. Is there any other means of getting food to him other than this method you just suggested?
This is the safest way for him to get feeding. It will be, as I mentioned, it's just a minor procedure. He just carry a minimal risk of getting something serious, like any bleeding, any getting infection, or any damaging to the surroundings. It's minimal possibilities, as this procedure done by expert team did this procedure many times before, and it will make your father get feeding with a proper way and with safe way, as he is difficult now to get swallowing through his mouth and through the food
Okay,
pipe.
doctor.
Okay?
It's okay. Yeah, I quite understand. It's okay. Yeah. If it
Okay,
says
we will discuss with your father more about this issue, and we want from your father the consent after he is accepting this procedure. We are just now give the headlines of this procedure, Mr. Daniel. Is that okay?
okay, that's okay. It's okay, doctor. It's
Okay. Do you have any other concern?
No, not at all, doctor. No.
So, Mr. Daniel, can I ask you some question about your father?
Okay, go ahead, doctor.
What do you do? What do your father do for a living?
Actually, my father has he has stopped working. Initially, he works the security officer. He works with the security agency.
Okay. Did your father need any type of support?
And currently, like you can see, he needs support in feeding. He needs support, but we are here for him. He has many children. I think we are ready to we are here to support to do that for him. So for now, we'll assist him with that.
Okay. If any kind of support we can offer for him, social and occupational support, and we will not let him go through this alone. We are here to bring and all the support your father needs. Did
Thank you
he
so
ever
much.
smoke?
Not at all. No, doctor.
Did he drink much alcohol?
No, doctor. No.
Okay. Did your father drive?
He was driving, but since the weakness started, he stopped driving, doctor.
Yeah, good. I highly appreciate that. He just need to stop driving until we review the DVLA regulation, and then we will come back to him to speak about that. Is that okay?
Okay, doctor. Okay.
Okay. So, Mr.
Okay.
Daniel, do you have another concern?
No concern, doctor.
Okay, I will just offer for you some brochure and leaflets to read about this motor neuron disease and also about this tube we discuss about it. And if you have any concern or a query, just contact us. Is that okay?
Okay, doctor. Thank you, doctor.
Okay.
Thank you, doctor.
Thank you.
Okay, perfect, Dr. Sarah. Really, it's a great one. But instead
Thank you.
of asking about smoking and alcohol, what do you think is important to ask here?
Last power of attorney, but I mean this is for patient, not for the
The same, okay,
defense.
the same concept of smoking and alcohol for the patient, not for the son or next of kin. But it's written there down in the chat box. Speak and try to get agreement or to sign a consent. Who can sign the consent? What do you think?
The patient
Yeah,
himself.
so at least, yes, you can say to the patient or to the son, we will sit with your father and we will get approval from him as a written one. And you can also talk with him if he's agreed to do this procedure. Okay?
Okay, the consent I already said it's from the patient
You
himself.
said?
Yeah.
Okay, sorry, I didn't hear it. Okay, so
Yeah,
it's okay, perfect.
she
Now,
said
Doctor.
so. She said so.
Okay,
She said so.
Dr. Henry will comment now. Okay, Dr. Henry will come.
Yeah, thank you so much. You did an amazing job. You followed the sequence. You started well. You asked, of my details, my knowledge, and everything. It was a good one. It was a good one. Yeah, it was a good one from my end. You did very well. Just you also you break your discussion into parts, which is so good. And also
Thank you.
you also try to, I think along the end, you try to, the only thing I didn't do that you would have done was to summarize, but you gave me leaflet, which is also good, and also the time too was not, you did very well, it was when the time was still on, start talking about smoking and alcohol, which in this case, I don't think that time will be there. Once you've gotten to the fact that you seek my consent, the next thing is just to summarize, and that was all. But hopefully, it was a good one, to be candid. You did well. Hold on.
Okay, thank you so much.
Okay, thank you, Dr. Neri. Please, Dr. Sarah, you can send the scenario for Dr. Neri.
Okay, I will send it now.
So the comment, I will comment only regarding the aspiration. Why you want to change the feeding or to do big tube? What the aim of the procedure? You said to save his feeding. It's not only that. Yeah.
To prevent the aspiration, I already mentioned it.
You mentioned also, okay, maybe
Yes.
some in between I didn't hear this sentence, But what I hear, like, it will affect his feeding. So yeah, it's mainly for his lung and the prevention of aspiration. Why? Because the muscle will be affected. The swallowing muscle will be affected. That's why it's harmful for him to keep him taking through his mouth. One of the team will be involved as well, a SALT team, swallowing and language therapist team.
Yes.
Yeah, you mentioned also.
No, I didn't mention. I forgot.
Yeah. So okay, at least I commented correctly now. Okay. So the team will be involved. This one, along with the big tube team, the team will insert the tube. You mentioned the procedure well. The patient will be prepared, and we will do it through a camera scan, through his skin cut, and so on. So it was covered properly, shortly also. No need to talk about them in details, which you did perfect. Other things, yes, if you have time, you can hand the leaflet brochure. You spoke about smoking and alcohol, which is not our aim in this or such scenarios. We are not talking to the patient, so no need to raise this issue with the surrogate or the son or whosoever. The most
Yeah, okay.
important here, initially, you ask about the next of kin, which is good. You assume there is permission from his father to talk about his condition, which is perfect. The introduction, everything, really, it was perfect from the start till the end. Apart from smoking, no need to mention it as long as he's not the patient. Driving, yes, it's good to mention. I hope your father stopped driving till further assessment. Why? Because the weakness might involve also the hands and the way he can drive. Okay.
Okay, thank you, doctor.
Okay, thank you, Dr. Well done, really. If you have, yes, you put this in.
معلش قول شوي بس كم نقطة.
Yeah, I will let you, Dr. Of course, Dr. Henry, you have to comment, but just to read the comment, the scenario for Dr. Henry, then I will let you
Okay.
comment. Okay, Dr. Henry, your scenario, Mr. Wait, I cannot see the name. Stephen Pernter, 66-year-old. You are the medical doctor in the oncology center. He is a hypertensive with a remote history of hepatitis B, which cleared and remained hepatitis service antigen negative. A month ago, Mr. Stephen presented with a history of high-grade swinging fever, weight loss, and fatigue. His examination was significant for diffuse lymphadenopathy and palpable liver and spleen. His investigation, the hepatitis B surface antigen negative, HIV negative, renal function, liver function are normal. Chest X-ray, PET scan, the cervical lymph node biopsy all confirmed the diagnosis of high-grade B-cell non-Hodgkin lymphoma, stage 3B. He started chemotherapy including rituximab, R-CHOP, 3 weeks ago, and after completing the second cycle 4 days ago, he presented with acute hepatitis, high liver enzymes, over 1,000 international unit, INR of 3 with high hepatitis B virus DNA and positive hepatitis surface antigen again. The rituximab stopped, admitted to the ICU with hepatic encephalopathy to receive FFP, fresh frozen plasma, vitamin K, and supportive therapy along with entecavir. Please speak to his next of kin, his daughter, Mrs. Sarah Printer, explain the situation and answer any concern she may have. 2 minutes or 3 minutes, Dr. Henry, then we will start with you. Dr. Hind, you can start.
والله very good scenario, the one you read.
Yes. Yes, very nice and good. And you?
Yes, it's a new, and I hope يعني it's really contain a lot of tasks, so it will be interesting one to discuss. Anyway, الباك tube scenario, just a quick remark على she mentioned investigation. هو حيكون في شغلات comments, accessories, let's say, or secondary, which really will make you appear fluent when you are performing. It will not cut your mark, but it will give you a good communication skills, marks, أو حتى evaluation by the examiner. You said investigation. We prefer the word workup. تمام? We did for him many workup, and we found out that he developed something not as we hope. Recently, they are not preferring not as we hope. They are preferring to say, and we found that he has developed something concerning. تمام? because I don't know how many candidates or they share their feedback, and the examiner was not happy, like what you are hoping. So it seems to be unprofessional. So they are saying no, and we found out that you developed something concerning. Or you can be specific that you have developed a complication of your underlying condition. It's up to you. But يعني, don't use this language, not as we hope, which is not professional and not specific. Okay, not explaining your scenario.
Okay.
Just a good comment, and actually يعني I found it a good one to خلاص adopted in our scenario rather than keep the sentence not as we hope.
Okay.
Second, you said I understand. هلا هي أنا متأكدة إنك ما لازم تقوليها. Okay? يعني so please give up on this word. You should always say, I can imagine how much you are stressed. I can imagine how the surrogate might leave the whole scenario and stuck with the word understand, and you will be in a big trouble.
Mhm.
Okay? And
Okay.
I don't know why recently, also they are not preferring the word progression, rather they want a long-term worsening symptom. هلا هذا كمان I don't know why, بس I notice it in many feedbacks. أو حتى يعني tutors, they are saying that it was mentioned in the feedback, the candidate did not explore whether the surrogate understand the meaning of progression of the disease. So you can use long-term worsening condition, okay, instead. بعدين you said then
هو the progressive is it's not jargon, isn't it?
هلا to be honest this يعني the word progression whether it is jargon or not أو حتى الكونتكست اللي ذكرت فيه يعني the time the context where the feedback mentioned that it was not appropriate, we don't know. طيب if you want to be safe when you
Yes.
practice, say long standing, and to be honest, long standing worsening symptoms make more sense to anyone rather than saying a progressive disease. Okay, يعني it's
Yes.
explaining the whole situation that it will remain for long and it will get worse. تمام, rather
Yes.
than combining everything in the word progression. And we used to say progressive, intermittent for us. So it might not be very clear. يعني it might have it might make sense. So try just to be in the safe side. You don't know what kind of examiner you will get. Okay?
Yes. Right.
Yes, right.
طيب
Yes.
بعدين you said that I don't know if you explore the expectations and thoughts.
Yeah, she asked. Yes.
خلاص okay done. And then you said then you immediately went without exploring how much the surrogate know about MND. You before explaining, especially when you are in front of a case, a patient or relative who had been exposed to the disease for a long time. So for sure he might have some knowledge. Don't anticipate and go through explaining. Just ask him, since you have been caring of your dad for a long time, how much do you know about MND, or you would like me to brief you from the start? He might tell you, no, doctor, I know about MND, and I know that it leads to long-term worsening symptoms. Then you will.
He's newly diagnosed now, just
Yes, I
just
get. يعني at
explaining.
least يعني show your examiner that you get the scenario. The scenario is talking about patient who was suffering from MND and now developed a new complication. So يعني reflect that in your explanation. تمام؟
Yes, clear,
هو
Doctor.
yeah,
So
clear, but
let
the
me,
the
Dr.
the
Sarah,
the
I will.
condition, it's newly diagnosed now.
Yes,
He has no
let me
idea.
clarify for you. It's not related to this scenario per se, as Dr. Hind saying. She's talking in general. If you want, or if the surrogate asks you, or you can offer that. Do you want me to explain, or you have some of knowledge about this disease, or some of information about this disease? If he asks you, please go ahead. Okay. If not, that's good. Go to the next task. Dr. Hind wants you to explain some or briefly about what the disease, okay? Not only in this scenario, she meant in general. Okay,
Okay.
Dr. Sarah? Yeah, so
Yes.
in any disease counseling, you have to give idea about this disease, why it happened, why his father. Even you didn't talk about unknown theory, right? Some patient, they have it as genetic. and some others they might have it as unknown. We don't know what exactly happened, but there is some discrepancy between the nerve and muscle, and they cannot listen to each other. That's why the patient have this weakness. Okay. This is in another simple way. If you want to mention, if he said to you, "No, doctor, I know more about it," or "I know about it," skip to the next
Sometimes even he
task.
will tell you, yes, doctor, I already read about it. لأنه على
Yes,
الأغلب
exactly.
they told them before that we are
Yeah,
investigating for a disease. Why I'm telling you this? Because sometimes already the scenario is given to you with a
exactly.
clear task that will consume your time. For they will
Mhm.
not make your life difficult. But if
Yes,
you did not take those advantage,
yes,
and even if they don't want to make your life difficult, you made it difficult by yourself by starting talking about things without exploring how much you know before.
yes,
يعني I might know that big tube explanation need time. So I will give you a
Yeah, but
surrogate.
the task here is explain the diagnosis. He has no
I
idea.
agree with you. صح. أنا هلا انتبهت إنه هن مقسمينه و it's a new case. بس anyway, in the exam, just be careful إنه your scenario, whether it is the same or different. And
yes,
even in this case, explain the diagnosis. The patient will tell you, no, doctor, nobody told me. I don't know anything about the disease. Please explain for me. At least you will, what they call it, a chunk and a check. So you have to give in pieces and you have to check the patient understanding before trying to give him the
yes,
information. Okay?
yes,
So you
Yes,
will
okay.
you will be surprised how much the relative he want to know. So don't give too much information which the surrogate might not be interested in, at least for you. Okay? Here I agree with you. You have to explain anyway because it's part of your task. يعني بصراحة أنت الكلام اللي هلا قلتيه it's make too much sense. بس
yes,
try to ask before you go on to explain anything. I would like to explain for you about the management. Is it okay? I would like to explore how much do you know about the diagnosis. Is it okay? Do you know the link between your dad diagnosis and the difficulty swallowing? No, doctor, I don't know. Okay, I would like to explain for you. They love to chunk and check technique. While if you try always to go into the topic immediately without preparing the surrogate,
mhm,
they will not be happy with this. As if you are just like telling information without
yes,
giving the surrogate time to contribute, or it's not like an interview between both a surrogate and a doctor. So try always to involve the surrogate, whether a relative or patient, by asking, do you want to know? Is it okay for you if I explain? And don't forget to draw. أعتقد إنك ما رسمتي، صح؟
Yeah, but
yes,
in real exam I will draw. Sure,
Yes,
it's
but
more.
please
Yeah,
try to keep it a habit, even in the online. I would like to draw for you. This is. Believe
okay,
me, if you don't do it like this, you will forget in the exam. So try to keep it
yes,
as a
no,
habit.
I mean the procedure. It's drawing scenario, and it's more easy for us to
exactly. Yeah,
explain.
it's a
More
must.
easy to
Yes,
do it with a drawing. تمام.
yes,
And don't
Yeah,
forget
sure.
with the SOL team the dietitian الله يوفقك. تمام. Because this is
Yes,
dysphagia. So SOL team, and don't say salt, say swallowing and language therapy team and dietitian to help. انتي قلتي protect his feeding. تمام. I agree
yeah,
with you. بس facilitate feeding and minimize aspiration is more
yes.
accurate, especially that you will not protect against aspiration. Why it is wrong to say protect against aspiration?
It might happen even with this big
it's
عليك
tube.
still
نور.
possibility. Yeah, it's still
Yes.
Yeah.
possibility.
So don't say it will protect. انت حتى اعتقد كان قصدك protect against aspiration بس قلتيها protect against feeding.
Mhm.
فbetter to say facilitate feeding, يعني to make feeding easier and minimize risk of
Minimize the
aspiration.
complication.
Please,
Yes.
because the whole scenario is to test. لو قلنا إذا في judgment in this scenario, it will be how much big tube will help in minimizing the complication. لأنه otherwise there is no judgment بالقصة. Just like
Yes.
explanation of diagnosis, explanation of big tube. But the judgment will be based on how much you know. If the surrogate asks you, doctor, will this procedure protect my dad from the choking episodes?
Mhm. Yes.
So here you will stuck if you didn't answer correct and you say it protect against. Okay? So you will say no.
Yes.
Still there are some aspiration precautions. This is very important in the management plan to mention. The whole specialist nurse and the district nurse and the teaching that they will provide to you as a relative will be based on two things: how to care for the big tube and how to apply a safe aspiration precautions to minimize the aspiration while the patient is on big tube, like keep the patient 45 degree, even higher, تمام, 90 degree while eating, تمام, give a semi-solid food, avoid liquid, تمام, and keep the patient upright 30 minutes or even the best is optimal 1 hour after taking the meal, تمام, لأنه he might even have a reflux from the tummy up to the throat. Okay, so the main education is to mention about tube caring, how to care about the tube, keep it clean, keep it patent, avoid dislodgement, تمام, plus aspiration precautions. فأحيانا كمان second judgment in such a communication scenario is a solid management plan. تمام, so you have to mention we will involve a nerve doctor who will keep him under follow-up for any progression, for any complication. It was perfect you mentioned about breathing, تمام, because this is something that might come as a next complication. Then swallow and language therapy and dietitian, specialist nurse who will try also to attend regularly to check on the tube, and they will teach you as a relative how to take care of the big tube and how to apply a safe aspiration precaution. Again, you will emphasize minimizing aspiration and choking episode as much as possible. I would love if you explain or elaborate about aspiration. Like there will be weakness in the muscles which regulate the food and prevent it from going to the lung. Rather, it direct it to the food pipe. Whenever these muscles are weak because of the underlying condition, this regulatory mechanism is lost, and the food plus the fluid will leak into the lung, and this will cause irritation and subsequent infection, what we called aspiration pneumonia. And those are the sequelae of the choking that you have mentioned as a surrogate. طبعا it was perfect also you ask him how is his eating at home. هذا كان أروع سؤال سألتي لأنك you want to know how his baseline was and what is the new development. So he was eating fine, suddenly he start to be choking, تمام, and he start to be unable to tolerate food. So you establish the difference. He was and he become. Okay, and then you enter to support that you will apply certain treatment to help in this new development. So your way of introducing the treatment was perfect actually. يعني هذا كان جزء رائع عملتي. You first
Thank you so
establish the change, بعدين you offer a solution. بس just don't forget aspiration precaution, كلمة tube care, and you can even elaborate salt dietitian, تمام, and don't forget to explain slightly about the concept of aspiration لأنه your whole scenario is about dysphagia and aspiration. So you have
I already mentioned the aspiration risk. It's because of the weakness of the muscle that lead the food particles will go to the lungs. I already
خلاص
mentioned that.
قلتيها معناتها أنا اللي missed
Yes.
البوينت. أهم شيء إنه you explained. خلاص.
Yeah,
Okay.
I already thank you, doctor.
تمام.
Okay, thank you. Yes.
The last
Thank-
thing is when you talk about the smoking and alcohol, أنت كأنك لما قال لك advanced decision, طبعا ما عاد صار اسمه advanced directive, advanced decision and LPA. Don't offer him to do it. The son might tell you, yes, my dad, he have an advanced decision not to go through an invasive procedure. تعرف إذا كان في advanced decision like this and you didn't pick it up in your scenario, you will lose the whole scenario.
How to pick it from the son? I mean,
Just
it's with the
the
patient.
son will know if there is any advanced decision. I'm not telling you, let's say the son said, I don't have any idea whether my dad have an advanced decision or not. خلاص, a full stop. You will not tell him, I would advise you to take your dad and go make an advanced decision. لا, خلاص, انت here.
But in this scenario, we are just first time to breaking this news for him. It's difficult to also speak with him about the AD and lasting power of attorney
Since there is
from
a
the beginning.
If you have time.
since there is a procedure.
No, I mean, it's breaking bad news now. I'm telling somebody you have a progressive disease that will lead to death
طيب
soon.
مو
And now
كان في
I will say
سؤال.
at the same at the beginning I told just please write your
But
wishes and I
don't
think
forget
it's
it can affect his capacity in the future, the motor neuron
I'm
disease.
no,
So
we have
it's
another meeting
something
with him. This is the first meeting
if you have
to
time,
discuss
Dr.
about
Sarah,
this.
it's not a
No,
must.
not matter of not time. I mean, imagine this is a real life, and you are just breaking very bad news for somebody that you have a serious condition that will lead to difficult
It's
طب
swallowing,
أنا عندي
difficult
سؤال. مو هو
breathing.
okay.
سألك
And from
كان
the beginning, and you will say, just please try to think about your wishes and your plan, future plan of. I think
not
it's so
asking him
difficult.
about any wishes. Did your dad express مو
It's
سألك مو كان في
advice.
سؤال
Yes.
كان في سؤال قال لك I am scared it is an invasive procedure. طيب and I don't want my dad to go through this. هون كان أنسب مكان تقولي له did your dad ever express his wishing regarding such an invasive procedures?
His dad
Before?
just diagnosed now. He has no idea before. This is the
Yeah,
first
some not
meeting.
only
He just
yeah,
know now he has
it's not a must,
خلص
doctor.
okay since see أنا لا why I'm saying this لأنه السيناريو which we usually discuss is never like a newly diagnosed MND who suddenly developed dysphagia and came with big tube. To be honest هذا السيناريو حقيقة is not like this. The patient have
Okay.
MND and have multiple admissions with aspiration and this time they decide to insert a
yeah.
big tube.
In
Yeah,
another
I
scenario,
agree.
yes.
So
Maybe in another
Yes.
scenario.
that scenario already the patient know that he have MND. And in such a way, smoking and alcohol can be replaced by just exploration,
Yes,
whether he have an advance directive
exactly.
or
Yes.
lasting power of attorney. Actually, if you are, if your reason why you did this scenario like this because it's a newly diagnosed, I agree with you. لأنه if this was your scenario in the exam, I agree with the concept of not discussing. Someone who has just discovered he have an MND, for sure nobody advised him to prepare such an advanced care planning. But this scenario, remember that it is not like this because it never happened that MND has progressed to extent that caused dysphagia. And I'm surprising a patient that he have MND and he have developed a complication and I want to insert for him a big tube. This is 3 surprises which will never be given to a patient at once at any circumstances. But anyway, if that scenario came, smoking and alcohol can be replaced effectively by just exploring. Don't offer. If they are not there, full stop. If he told you, no, my dad, he never discussed with me such an issue. خلاص. Close it. But if he told you, yes, my dad, he had, since he was diagnosed, he said he don't want any invasive procedure and he want everything to go naturally as it is without any interference. Okay, then this will be a very big clinical judgment point to be explored because usually the son and you ask, are you the next of kin? Are you the carer? So he might be even the closest person to the dad. So it is justifiable to ask. He would know if there is anything, especially that he was not happy with the invasiveness. So at that point, it would be very, very good to ask. But let's again go back that your scenario was a newly diagnosed. So take this point away, except if it was the other version of the scenario where it has been already diagnosed since long time. Just بس أنا اللي لفت نظري إنك أنت اعترضتي عليها لأنه relative. لا, relative you can ask if it is there or not.
Not
But
only
don't
relative,
offer.
the next of kin as well. He is next of kin, so he will sit with his father a long time to know if the
He
father.
will know, but if you want them
Like,
to prepare, صح, don't ask the next of kin to prepare for his dad. You will go to the dad and you will offer that we want you to go through a process called. So the explanation of the process better to be done direct contact with the dad. But to explore the presence or absence of such a document, you can do it with a relative. Did your dad express his wishes in a document? No. خلاص, that's it. هلا في ناس they will continue. Okay, I suggest that your dad go and prepare. No need, because this has to be done by the dad, and he is the one who will go through the process and fill the form, not the son, not the next of kin. But the next of kin, if that document is there, or he is the lasting power of attorney, طب مع سؤال كمان, he might be himself the LPA as a relative. So it is wise to ask. are you the LPA? Any document has been written by your dad? So you are not, يعني it's not irrelevant, I mean. But the preparation of those documents should be discussed with the dad. بس هدول الissues. I'm sorry, really, I made it lengthy.
Okay, thank you, Dr. Hen. Thank you. Maybe in another scenario, as Dr. Hen said, if the patient already suffered a lot and he has a long-term disease and he knows about it and he's going back to the hospital with multiple admission, here you can ask about any expression related to the wishes or anything he want to be done regarding his management plan. That time you can ask clearly and you can be brave to ask this question. Here, yeah, as first time, you can say maybe in another meeting after discussing the situation with the son or with the father. Later on, we can set about and we can talk about the future plan. Thank you, Dr. Hinda again. We can start, Dr. Hinda, ready?
Yes, I'm ready.
Yeah, here you go.
Hello, I'm Dr.
Hello.
Henry, one of the doctors here. May I confirm you are Mrs. Sarah Pinter, the daughter of Mr. Stephen Pinter?
Yes, I am.
Okay, good to see you, Sarah.
Thank you.
Sorry if I may ask, may I also confirm, are you the next of kin of Mr. Stephen?
Yes.
All right. I've come to discuss concerning the health of your dad with you. Is that okay?
Okay, doctor.
Okay. I don't know. Do you want any friends or relative to be with us while we discuss, or you're okay with us discussing alone?
No, doctor, it's okay with me.
Okay. Just to ensure that we are on the same page, I want to assure you that whatever thing we discuss today will be kept confidential, and all the things we discuss is going to be for the betterment and the best interest of your dad. Is that okay?
Okay.
All right. Could you please tell me what you understand concerning your dad's health and what they've told you concerning his health, if you don't mind?
Yes, doctor, sure. Really, I'm so worried that my dad has just suffering from some high body temperature, and then they just take snap from his neck. There is swelling there, and taking snap, and then he diagnosed with some type of blood cancer or so on. They just give him through some medication for this cancer. I think it's called chemotherapy or something. After that, my father just started deteriorated, and now he's just, I don't know, he's there in the ICU and he's very, very sick, and I'm really worried. And what's happening, doctor?
So I want to thank you for your knowledge, and at the same time, I'm so sorry about your father's condition currently and what he has going through, knowing fully well that is in this situation he is right now. Sorry to say, are you aware that your father has high blood pressure previously?
Yes, doctor.
Okay. Are you also aware that your father had a condition called hepatitis B that was cleared previously?
No, doctor, so long, years, very years back, he just treated with this hepatitis, and they said it's no hepatitis now.
Okay. Yeah, good. Thank God you are aware of it. What I want to say is that your father, like you said, has a blood cancer and was started on some medication some weeks ago. And absolutely he has had 2 cycles. He has completed 2 cycles. And like you
Yes, I
said,
know, doctor.
he started having fever and confusion some days back. And actually, we did some tests for him, and we noticed that the hepatitis B has resurfaced again.
What do you mean, doctor?
What I meant is that the hepatitis B that your father had before that was cleared have resurfaced again, and this time around, it's so critical to the point that we have to admit him in the intensive care unit.
So you mean my father getting hepatitis B again? What happening, doctor? Why? He was okay, nothing was happening, with him with hepatitis, and he just was fine.
Yeah, and thank you for your question. Actually, what happened is that one of the medication that we use to manage his cancer, which is called rituximab, one of them it's have the tendency to make an inactive or an hepatitis B that is cleared to resurface again. And I'm so sorry that might be what has really triggered or probably reawakened the already cleared hepatitis B that your father had previously. I'm so sorry to let you know
So,
about
doctor,
it.
so you are the responsible for suffering now of my father. You give him this such bad medication, and now he's suffering there.
I quite understand your fears and you're worried, but just to let you know that actually before we give this particular medication, we usually counsel patients, and I believe and I hope probably your father might have been counseled before we started this medication about some of the side effects of this medication, of which one of them happened to be to reawaken this hepatitis B that we think might be what is happening, be the cause of this hepatitis, this new hepatitis, which is a new soreness of the liver that is currently having now. I don't know if
No, doctor.
it is
No. This is your mistake, and I want to do complaint.
okay. I think it's good. It's your right for you to get complaint. Usually, there's before I probably give you the avenue on what to complain about. It's good you understand that based on the fact that your father started having this confusion, we admitted in the intensive care unit, and we've stopped the medication, which is called rituximab, and also we've started a blood therapy called fresh frozen plasma, and also we started vitamin K. And currently, we've also commenced the treatment for the hepatitis B, which is called entecavir. Concerning your complaint, I think it's your right to complain. There is a body, an independent body that will help you out. It's called the Patient Advisory Liaison Service. If we want to assure you that if you're ready, I will give you the contact, and I will ensure that you complaining will not in any way affect the way we will handle your dad. I don't know if that's okay.
Is that okay, doctor? I will do complaint, and take care of my father, because this is your mistake. So my father will be okay, or he'll just will suffer more?
That's a good question. Actually, your father is, like I said, is currently in the intensive care. We are doing our best to ensure that he recovers from this condition, and we'll start the treatment, including the supportive treatment that will involve him to get better quickly. And I want to assure you that all hands are on deck. All the specialist team are involved. The cancer teams are here. We've involved the liver doctors and also involved the blood doctors. They're all, also the specialized nurses. You are all here to ensure that your father gets the utmost care. I don't know if that is okay by you.
It's okay, doctor. I just want my father to be okay again. I'm really worried about him.
Yeah, your father will be fine. We'll do our possible best to ensure that your father gets the utmost care that he deserves. Do you mind if I ask, do you have any other concern? Sorry.
No, thank you, doctor.
Okay. Sorry if I'm asked, do you know if your father have any existing wish on how he wants to be treated? Eventually, he can make decision by himself.
No, really, I'm not sure, doctor.
Okay, because I am as it is now, knowing fully well that your father has high blood pressure, you also have a very high blood cancer, and now he's having a disease of the liver, which is called hepatitis B, which is the soreness of the liver. And
2
in this
minutes
case,
left.
he's having a confusion, and he's currently in the intensive care unit. all this shows that your father's condition is very critical. I'm afraid to tell you that. And it is good
It's
for us to
critical
know.
because of your mistake, doctor. You give him that such bad medication. That's why he's critical now.
Like I said, I understand your fears. I understand your worries. And I'm sorry that this condition has resulted to this, but I'm assuring you that this, I don't think it's our own mistake, if you don't mind. But like I said, we'll do well to if we look into it, and if it's by any form it's our own error, we'll come back and further render our apologies to you and ensure that similar things will not reoccur again. I will talk to the my consultant and also look into it and see if he wasn't given that counseling before they start the medication. If so, we'll see how we can rectify that. I don't know if that's okay.
Okay, doctor, thank you.
Okay, and just to ensure that we are on the same page, or if I can just summarize for you, your father, like I said, his condition is critical now, and currently we may need, if he has any wish, because of the critical condition, if he has any wish on how he wants to be treated in terms of, in case of if we resort to what we call palliative care, that if maybe we can no longer proceed in giving him something that will cure him from the condition, we may need to, if he wants to be taken care of at home or in the hospital or in the care home. These are some things that I want to discuss with you, and so that we can able to, if you can give us a go ahead on what to do in terms of his best interest concerning his condition. I don't know if that's okay.
Okay,
Okay.
doctor.
Thank
Okay.
you so much. Yeah.
Okay, thank you, Dr. Henry. Well done.
Thank you.
We will comment regarding this scenario after Dr. Sarah comment. You can start now, Dr. Sarah.
Well done, doctor. Actually, I bring this scenario to discuss about. I think it's difficult scenario because I don't know, is it error or no? I'm not sure. Dr. Henry, at the beginning, he doesn't apologize, and he just deal with it. It's like we explain everything for the father, and he knows the possible maybe side effects or so on. But at the end, he just apologized. I'm not sure really if it's for apologize or no, as they did all the investigation before starting this chemotherapy and this rituximab. But on the other hand, I don't know if just hepatitis C, hepatitis surface antigen was enough for as a preparation for chemotherapy or for rituximab, or we just must do all the hepatitis B panel. I mean, the hepatitis B core and the DNA for hepatitis, or no, I'm not sure really. So I'm waiting for the feedback also from Dr. Basma and others.
Yeah, thank you, Dr. Sarah. Apart from this, do you want to add anything regarding the other performance, regarding the discussion?
At the
Anything
beginning, actually,
he should raise apart from the counseling about disease?
actually, I was concerned about this, and he tried to
Okay, that's why you repeat the
keep
question
this
three
my
times.
concern. Yeah,
Yeah, okay.
but
I will clarify this point. Did he mention lymphoma?
yes, he mentioned, and he's on chemotherapy. He mentioned it already.
Yeah, he mentioned the chemotherapy, but did he
Yeah, and
mention?
he also said he's in stage 3 and so on. He already mentioned everything.
Okay, so this is very important to speak about what's ongoing now. There is cancer of the lymph gland or lymph node, which are part of the defense system in your father body, and there is cancer inside these parts. Okay, other thing, yes,
No, doctor, he just diagnosed with lymphoma and stage 3 and so on, but
yeah,
he didn't
that's why.
explain the lymphoma itself, because I already know we are now after 2 cycles from chemotherapy.
Okay,
We
so
know everything.
he asked you and you said no need, or did he offer that?
He didn't ask. Actually, he just
Yeah,
say your
this is
father
what we
has.
spoke about, me and Dr. Hind, the previous scenario. What the condition here, the lymphoma, which is extensive and spreading. So you have to speak even briefly about it, or you can ask the patient or the surrogate if you want me to explain what's ongoing. Patient doesn't know what happened. This is the first point. And regarding the mistake or not mistake, complication or an error, I will clarify this point. The last statement from Dr. Henry was very good. I apologize if there is defective or mistake or something missing if your father doesn't know about this complication. Okay? I prefer to do it earlier. It's not an error. If the father knows about this complication, it might happen again or recurrence of his hepatitis again after commencement of this medication. So no error at all. Is it side effect? Yes, it's a complication for every monoclonal or biological therapy. It might have a complication of recurrence of previous viral infection. That's why we are warning all the patient. We are getting consent. One of the important parts in the consent that the infection might recur back or he might have viral infection because of the immunodeficiency that he might have after administration of this medication. Clear? So to
Yes.
be more neutral, as Dr. Henry said at the end, if there is missing parts during the conversation or taking the consent from your father and he doesn't know about this complication, okay, we can apologize for this. But if not, no, it's not an error. It's possible side effect. It might happen with this medication. Usually, our habit, we sit with every patient. We are saying and we are explaining what are the possible side effects that might happen or appear after commencing this medication. And hopefully, your father was aware about this. We can also go to the records to discuss and to check if everything was explained to your father or no. If
He
done,
should raise the incident report or no?
no, no.
He
Why?
didn't. He
Why?
he
No,
didn't
no.
mention because it's uncertainty here.
Yes, I didn't say it's an error. If you are sure this is an error, you can do this, but it's not an error. It's not a clear error. Even if the father doesn't know, we will have to investigate that. We don't know what exactly happened with the father. Maybe he was explained, right? If not explained, that time we have to, and this thing will appear with the investigation. From what team? From Pulse office, which he mentioned already. And the good thing also, he said, and he reassured you that the care of your father will not be affected, it will not be the change after your complaint. This is another good point. Really, Dr. Henry did this scenario perfect. I like the way he talked today. He was very confident and he was talk, talking and asking in the same way, not interrupting. And he offered a lot of questions. This is the best way, Dr. Henry. Try to keep on this way. And I think this is my comment. If you want to ask anything else, Dr. Sarah, you can ask or you can add.
No, I have question, doctor. You
Yeah,
said
yeah,
this case is uncertain, uncertainty.
yes,
We are
yeah,
all agree.
yeah,
So we will investigate.
yeah.
Yeah. So
Yes,
what is the
exactly.
incident? Incident report is a report
When you have a
to
clear mistake.
investigate. No, to investigate. We are just here now. We want to investigate.
Yes, but there is uncertainty. You don't know what happened exactly. Why you will raise when you have a solid material that there is a mistake, there is patient or there is a nurse went inside without gloves. It's documented, or there is medication already given and it was by mistake. Instead of giving to another patient, it was given. So the medication or the medical error will be clear in any scenario. Regarding reconciliation of medication, patient admitted and he was on anti-epileptic medication, and by mistake the ER doctor or the medicine doctor didn't prescribe this medicine for him. So it's a clear from the task outside or from the scenario outside that the patient had or the doctor did a mistake. He didn't explain, he didn't. But here you are talking with the son who doesn't know more about the father. Maybe he's assuming that no one informed. Maybe this is a mistake. We don't know. He doesn't know. We have to investigate how I will raise and why I will raise an insert report. It's not a clear. You got it. If it's clear
Yeah.
from the scenario, you can
No,
raise a incident report. Yes.
I mean the incident report. It's only for the error, but it's just a report to
Yes.
investigate. I mean, even the cases of uncertainty, we need to investigate, not only for
Yes.
apologize for error.
No need for incident report, you mean? Yeah, if uncertainty, you don't know what exactly happened, you can do the investigation, but without incident report.
Oh, she
What is
can
the
do the same when she
yeah?
said
What
if. هلا شفتي انت وقلتي if we found out that there was some miscommunication, if we can at that time initiate a full investigation. قصدك بين قوسين incident report and we apologize on the behalf of the team. بس
yeah? I
always
mean that
mentioned as you said if
incident
لأنه it's uncertain.
incident report, is it just for medical error, or we can raise it in uncertainty? This is my question.
لا, it can rise at any time and there is no mistake
Yeah,
by giving an incident report. But
yeah, that's what I mean.
the way you will bring the incident report into the scenario should reflect how much see هذا السيناريو, the aim of this scenario is to see you as a doctor بالmedical ward, can you differentiate between complications and error ولا you cannot. You know what is the best practice and how your team is usually working ولا you don't know. The best practice we sit, we counsel, وفي جملة واضحة كتير بالسيناريو يلي أنا مخليتني أقول أنا ما يكون هذا السيناريو it's not uncertainty. Why? It's mentioned
Negative,
clearly.
yes.
His investigation, hepatitis B S antigen negative, hepatitis HIV negative, RFT normal, LFT normal, before initiating. So they want you يعني حتى أول سطر قال لك إنه the patient have be cleared and remained hepatitis S negative. So they want to direct you إنه the team before initiating they didn't initiate haphazard. They know that the patient should go through an investigation and those investigations were done حتى chest X-ray, which mean that they are excluding active TB. يعني الجماعة مكفيين وموفيين. In view of such a way of doing يعني such a scenario in front of me, I have to be like, do you know, trust my team slightly. ما حقول إنه it's not uncertainty, ما حقول إنه a surrogate is wrong. No, I will not say. Whenever a surrogate raise a concern, I should respect. But I have to reflect this in my counseling. If I will raise investigation, if I will apologize, I will always mention the word if. حتى حافظ على ما وجه التيم تبعي. So I will say if my team didn't counsel your dad about the side effects and the complication of those medication properly, and it turned out that your dad was not did not understand the sequelae of starting it completely, I apologize on the behalf of the team, and we will run full investigation in the form of incident report, and then we will come and update you. فأنت when you mention it قلتيها بإطارها الصحيح إنه
And
إذا
Dr. Henry did
تستطيع.
so, Dr. Henry at the end he did so.
He
So
did
you
so, but he said if I apologize without the incident report. فدكتورة سارة زعلانة.
okay,
ليه
so
ما جابت سيتي
No,
انسيدنت؟
no, I'm asking. I'm
yeah, no,
asking,
she want
is
to
it
clarify
time
the
to?
things. Really, it's a good
Yeah, I
scenario.
mean, I want to
Yeah.
understand. That's why I bring
Yes,
this
yes.
عليك
scenario,
إنه
because
أنا
I'm not.
هيك عم قل لك إنه your
Yeah.
suspicion أنت عندك سؤالين. الانسيدنت ريبورت أولاً ما له علاقة بالإيرور حتى لو كان في misbehavior misconception، لأنه الانسيدنت ريبورت ممكن يموت بمكانه ما يكملوا فيه investigation وممكن يكملوا فيه investigation. It might be stopped at the initiation يعني they don't continue to investigate because it's a simple matter, trivial matter, it was corrected, it was solved، وممكن يكمل investigation لآخر الطريق. فالincident report is not an issue. Nobody gonna cut your mark. Only they will cut your mark إذا الexaminer شعر إنك you are dealing with the scenario as an error not as an uncertainty باستحياء، لأنك أنت عندك قناعة إنه they did everything. فأنت at the end when if you couldn't calm the surrogate and the surrogate is very angry and he's confronting you, doctor, nobody has told my dad. How come he's confused now? You answered, you explained مرة مرتين، الثالثة خلاص تعتذري. I apologize. If وبعدين على الأغلب السيروجيت بهالسيناريو he will tell you, doctor, I'm sure I was with my dad. Nobody has mentioned that this infection might reactivate. Otherwise, I would not accept that he take the medication because we suffered too much when we had the viral infection. فهي will tell you this clearly. فأنت خلص مجرد you found that he is very upset, you will say the sentence that Dr. Henry mentioned in the last at the time when this concern is raised. لأنه هذا الكونسيرن أكيد حيكون موجود. أغلب هي السيناريوز patient will doubt your consultation about the complication. تمام. You will tell him if there was at any time a poor communication from our side and your dad did not understand the complication completely, or we missed to tell him exactly what will happen, we apologize. واحد اثنين, we will run a full investigation, internal investigation in the form of incident report. إذا بتحبي تقولي هذا مثل ما هي, لأنه internal investigation is a form of doing the incident report, to call for urgent meeting, و involve the full team and the consultant وكل الهلمة, يعني the whole package of the error. بس I would prefer إنك أنت to give it a very short time in your scenario. لأنه you should be very sure إنه such a scenario is a complication and the surrogate is pushing toward uncertain error. هي القناعة لازم تكون عندك. لأنه if you at any time give the examiner an impression إنه you are feeling it is more like an uncertain error and there could be an error rather than a complication, يعني you don't know what evaluation you will get from him.
Yeah, because you don't trust the team. Means that you don't trust the team.
فأنت لازم يكون في عندك نوع من البالانس. Trust
Yeah.
your team, trust
Yes.
the process, وespecially إذا كان السيناريو واضح.
Clear, yes.
وفي points, positive points toward the team. يعني positive point إنه التيم شغال through a evidence base. حرام, ما عليهم غلط. فأنت you should always think your priority of thinking, trust the process, it's a complication. Now the surrogate is also يعني دائما السيرجت على حق. So he's saying the truth. It could be. Now the second priority, it could be. فلازم هذا الشيء ياخد منك جزء صغير بالدiscussion. You shouldn't give it a big part of your discussion. Start it in one concern and finish it at the same time. Don't extend. تمام. If I apologize and we will run an internal investigation. But again, I can reassure you that your dad has received a full proper consultation with all the complication, but it seems that you are too much worried about your dad and we will look into it again. بس خلاص, finish it. Is it okay now if I continue telling you about the management plan we have arranged for your dad? فحاول انك انت كمان تدفي بعيد عن انه يكمل بالموضوع. و if he want to issue a complaint, he will issue. طبعا هون كمان ممكن يكون في concern. Doctor, why my dad is confused? Is it because of the reactivation of the hepatitis B? What will be your answer, Dr. Henry?
Thank you for your comments. Can you please come again? Can you go by it again?
Yes, is my dad is confused because of the reactivation of hepatitis B? What is the cause of confusion of my dad? Why he is not on his usual senses?
Thank you for your question. That's a very important question you just asked. Actually, the confusion of your dad might be due to the reactivation or the reoccurrence of the hepatitis B, and at the same time, it could also be due to the progression of his condition. But let me assure you that we are doing our best. First of all, we've stopped the likely cause of the hepatitis B, which is the drug that he's taking. And at the same time, he's currently in the intensive care unit, and we've started the treatment for the hepatitis B going forward. And also we've started getting a fresh frozen plasma blood that will give to correct the bleeding tendency that he had. Yeah, I don't know if that's okay.
No, you are right. You shouldn't be sure about the cause of confusion. In your dad, there are multiple causes that could explain the confusion. At this moment, he have hypertension, right? So it can get uncontrolled. He have hepatic encephalopathy. He is on INR, okay? and he has also underlying lymphoma. So what exactly the cause of confusion, we don't know. It could be mets from the lymphoma, failure of the chemotherapy, hypertension uncontrolled, hepatic encephalopathy. So just tell her there are multiple causes of confusion in your dad, and it could be related to the reactivation of hepatitis B, or it could be related to the underlying cause, which is the malignancy, or even the other comorbidities or other diseases like hypertension. Okay, so for now we are putting him under observation in a high dependency unit, and we are managing all possible complication, and we are monitoring. Please, the word monitoring is something the examiner is waiting. I don't know if you mentioned at any point that we were monitoring your dad for the complication of the chemotherapy during the follow-up. So also mention that before this occasions happen, before this event has happened, we already, because she was very angry, doctor, why you gave him the wrong medication? You should tell her that since we are aware of the complication of the medication, we usually counsel our patient about the complication, inform them about the red flags that they should monitor themselves for, and we from our side appoint a follow-up meetings on regular interval to monitor them by questions, history questions, and by lab investigation to pick up those complications early. Believe me, such a solid way of monitoring will even alleviate and calm down the surrogate. Because you people are, usually we are anticipating, we do our best to monitor the complications. So this will make the surrogate relaxed, happy, confident about your management plan. So tell about the monitoring and follow up. And you forget to tell a very small information because she become angry. How come, doctor, she was okay from hepatitis B and cleared it, and now when you gave the chemotherapy, the hepatitis B came again? You were insisting about the concept of reactivation, but there is a very important information to tell.
Okay, what is it?
That
Investigation
whenever
negative.
قولي دكتورة سارة ما سمعت.
I mean investigation done before and it was negative before starting the medication.
حلو, بس what is the character of hepatitis B virus؟ مثل الهربس زوستر, مثل التي بي, صح؟ They remain dormant, they remain sleepy, inactive, even if the markers are negative and you look like you cleared the virus. It is a character of this virus that it remain dormant. I mean by dormant, sleepy, in an inactive way, waiting the chance or the opportunity. When the defense mechanism fall, it become active again. And this what happened with your dad. Since he developed this cancer, and we were in front of one option to start medication to control the cancer and dampen down the defense mechanism to control the cancer, we gave the chance for those dormant viruses or sleepy viruses to wake up again. So the idea of having a dormant virus is very important. So even if it is cleared, even if you are treated at any time, and even if you don't have hepatitis B in your past history, فما بالك يعني if you have a positive history, this is more risky. Some people, they don't have at all in their past, and still they have it dormant somewhere. So the word dormant, sleepy, inactive, which explain the nature of this virus and its ability to come back again, will make it easy for you that it's not you who bring back the hepatitis B from air because of your medication. It was there, and it was dormant and sleepy, waiting the chance for the defense mechanism to drop for it to become active. And actually, unfortunately, this is what happened in your dad. Tamam? So the idea of being dormant and sleepy is very important in explaining and making the surrogate understand what is going on. With monitoring, we mentioned the monitoring is very important. We mentioned the concept of if we will do, if this was missed, we will do kaza and kaza. And that usually we give our patient a good monitoring, good follow-up, and red flags. And we keep them visiting us regularly to pick up the complication of our medication early to calm him down. Okay? And I think I like too much when you talked about the critical situation. in such a scenario, what is uncertain is the prognosis. But I want you to be very careful. Did you notice that at the end you told him that I would like to sit with your dad, explore whether he want to receive his treatment at home or in the hospital? You went too much in the end of life pathway. While this case, we don't know, he might resolve, get better from the confusion, and continue his chemotherapy. But you went into the end of life. This will be considered a negative point because here the prognosis at this moment is critical and is serious, but still is uncertain. There is a chance your dad will get better, and there is a chance he will deteriorate. And we will have a follow-up later on and update you which pathway your dad is going through. In case he get better, there will be a continuation of the treatment of his underlying disease, I mean lymphoma. But if he get worsen, then we might discuss the future and advanced care planning. That's it. You shouldn't go through details, and you should give the possibility, as I did. He could improve, get discharged, continue his chemotherapy for lymphoma, and live his life happily ever after, or he could take the other pathway, keep deteriorating, confusion is not resolving, and he might enter the end of life pathway. If you didn't reflect the uncertainty in prognosis and you went through one pathway, like we will sit with your dad, we will talk with him about whether he want to receive, and also the dad is confused. So the way you were telling as if you will get a chance to sit with him, you were not very clear that in case your dad improved, but also in case your dad improved, this means he's taking the good pathway. Why you will sit with him and talk with him about where he want to receive his care, which is a part of end-of-life care. When we give up on the patient treatment, we ask him, where do you want to receive your treatment and spend your last days? So I think this part, it was not the best to be discussed this way. But otherwise, when you tell your dad is critically ill and we should be careful and monitor him, this is right. You should stop here. If you want to elaborate, you should reflect the pathways. Whether he can improve, he can deteriorate. Because nothing in the scenario reflecting. He's still receiving maximum support. ICU, fresh frozen plasma, vitamin K, and he started hepatitis. So the ceiling of care is the maximum ceiling of care. So they are still hoping him to get better. So you shouldn't discuss those two sentences you did at the end, okay?
Okay.
All right.
Yeah, thank you, Dr. Hind. And thank you, Dr. Henry. Any other comment, Dr. Sarah? Because this is your scenario.
Yeah, one
Yeah.
question
Yeah.
from the beginning. I'm asking, is it enough to do hepatitis C, hepatitis B
Okay. As a clinical
service
judgment.
antigen? I mean, this is the only marker we need, or you should do all the panel?
Okay, as to be honest, we should call for the infectious disease team or the immunology or the hepatology to answer this as a part of PACES. I don't know clearly, is it possible to have negative hepatitis B service antigen? Is it enough? Dr. Hind, if she has some information about this, she can answer it. But otherwise, I'm not sure, is it enough or no?
هلا see
Because
I will also say
because
I don't know for sure لأنه البيولوجيكال
Yeah.
usually for screening it's very wise as a patient he had and he cleared إنك you screen by S only, and if you find S is high then you
Yeah.
continue for the DNA
Yeah. The
PCR.
core
بس
and
يعني it is not usually that when we run an investigation we find DNA and core, but the only issue here that he has a previous history. So whether we need to be more meticulous or not, I agree that it should be like,
detailed
yes, detailed. Maybe if
panel.
we
Yes.
ask someone who is expert in biologic and like he's working in rheumatology, and he might tell that if there is a past history, we are more meticulous and we order the full panel. Or he might tell you, no, it's still because he's negative. He cleared the virus. So I need to screen, and then I need to go if the screen
Yes.
was positive. So let's يعني just say إنه since you will say if you are covered until you covered your back. When you say if there is any shortcoming from the team side, whether in counseling or in the investigation, I apologize. فأنت your back is covered. since you don't know. And believe me, nobody gonna ask you about this detail. If you are doubting anything in the scenario, like the investigation is not clear, but be sure إنه I'm not testing your knowledge. Like you as a
Yes.
doctor coming to the cases, it's not your
No,
job to know.
no, it's not like we are testing the knowledge. I mean, if the whole panel should be done before starting
طيب you
rituximab,
should
it will be
know.
mistake because
No,
they
no,
did
wait a
just
minute.
service antigen. But
No,
if
no, they will
it's
not
just
go in
enough,
these details, Dr. Sarah. Too much detail.
too much. يعني عليكي انت هلا كدكتوره شو لازم يكون الليفل
Yeah.
اوف يور نوليدج لحد ما تقري هالسنتنس تفهمي اذا هي
Subspecialty.
صح ولا لا. لازم تكوني اروماتولوجيست who start a biological
Yeah.
وهذا عباره عن
Subspecialty.
specialized.
Yes.
واحيانا حتى هذا
so
الروماتولوجيست بينادي
in this
الجي اي.
scenario, we accept it's done. All the investigation
عليكي
is
No, no.
نور
accepted.
as a level of basis candidate senior
Yeah.
Okay.
ريجسترار. فأنا إذا شفت السنتنس as a senior registrar I don't have to have a very full knowledge about exact
Yeah.
details. So I would feel إنه they did their part. طيب I want to be covered, extra cover. I will say if
We will call them.
investigation, yes, if the investigation were not appropriate to exclude hepatitis B or the consultation which was run between us and your dad were not appropriate and did not cover all complication, I apologize. فأنت حتى لو شاكة فيك تضيفيها على الإف بعد الإف if لأنك شاكة if it was not appropriate investigation. بس هلا أنا كإكزامينر حقول لك والله why you didn't consider the scenario as a mistake لأنه patient قبل بيولوجيكال ما بيكفي الهيباتيتس اس انتيجين انت ما اكتشفتي هالغلط. I will يعني هذا ظلم عظيم. يعني هذا ظلم عظيم لأنه نحن هلا كلياتنا قاعدين بالميتينج nobody has such a very
Yes.
detailed knowledge.
Unless
تمام.
he
even
has.
though دكتور باسم ما شاء الله passed the exam يعني some people they pass the exam ف don't blame yourself too much.
Yes,
بس
exactly.
doubting is your right to doubt so include it after if to cover your back بس.
Yeah. And
Okay.
you will know it only, Dr. Sarah, you will know this situation only when you face it in your practical life. I mean, if you have such patient in your clinic or in your hospital and he had this issue with him and it has reviewed by the clinical, for example, the immunologist along with the hematologist, rheumatologist, and they decided to do so or to do that, you will know this situation. Otherwise, it's very rare and it's not again the test of knowledge. They will not test how you deal with this as a knowledge. No, they are asking how to do it or how to deal with it as an answer, how to communicate with the patient, asking information you don't know in details. And this is not your this is not your responsibility to have a decision on it. Okay, you are not a
Okay. So
hematologist.
in such scenarios, they did everything before giving the
Don't
patient
assume.
rituximab,
Don't
and
assume.
he's okay.
Don't assume everything done unless it was written. You can assume that everything discussed with the group of doctors who are responsible for this part. If you want to be more sure about it, we will talk about or we can call the doctor responsible for this part. Okay? Don't answer like you pretend. Don't pretend that
Mhm.
it has done because you don't know. Maybe it's not there. And don't say, I don't know. The best answer is to call the doctors who is assigned in this part or who is responsible for this part. If he assume that, by the way, they will not ask this question. I think you are the one interested to know, but never ever in the exam they will tell you, doctor, do you think the hepatitis S is enough or hepatitis B?
No, I didn't mean that. I mean, it's
Yes.
before giving
No, no,
rituximab.
no.
Is it
No, no. It will not be an error.
just to deal with the
I got it.
scenario as uncertainty or
No,
just
no, no,
complication?
no, no.
That's
It
what
will not
I'm
be
asking
in
for.
such detailed. Not in such detailed. Okay. I will give you another example. Okay. I had an experience in the exam. I had a patient with ICH. Okay. Because of hypertension. And after starting nitroglycerin, they started nitroglycerin for the patient. And after starting nitroglycerin, the patient had ICH. So I will start the scenario again. Patient presented with very high blood pressure, 220 systolic. And after he had this event of hypertension, they started him on nitroglycerin. And after that, they discovered that he had massive ICH. What I started to assume, the NTG or nitroglycerin, it was the cause of his ICH. Why? Because what I know, the nitroglycerin is vasodilator. What I did in the scenario, I talk about it has complicated, the hypertension was complicated with the ICH. I didn't talk about nitroglycerin side effects. What I want to say, don't assume because of this and it wasn't written or documented in the scenario. If I go through the nitroglycerin and it was an error and I drive the scenario as an error, maybe I will fail all the station. What I got in this station, I got 14 out of 16 because of the comment it was interrupting the daughter. Okay, they minus me in the clinical communication. What I want to say, don't assume something not written. If clearly written information, okay, go ahead. If not clearly written, don't assume supposed to send this lab to have a decision for that. Don't assume the medication started and the side effect happened because of this medication. If they didn't mention, don't assume it. You got it, Dr. Sarah?
Yes, I got it. Thank you, doctor.
Okay. Thank you, Dr. Sarah and Dr. Hina. Any other comments? Anyone
And
want
even
to?
if,
Yes.
let's say that he asked you, doctor, did they exclude this properly? I would push you to tell that at this point, it's really beyond my knowledge.
Mm-hmm.
So we will involve the proper team to look into the investigation which has been done to your dad. And again, if there was any investigation
Exactly.
which was not done, tamam, to your dad for proper exclusion, so I apologize on the behalf of the team, and we will honestly and transparently come back to you and
Mm-hmm.
admit about what happened and update you about the results of investigation. So even if يعني حتى لأنه actually, to be honest, into your fears, whatever you are feeling from is true. إنه sometimes the surrogate is pushing me, and I want to have I want to know how to go, whether to go with the surrogate or to stay with my team, trust my team.
Yeah.
Because he is asking about something you don't know, and you feel that it is beyond your knowledge as a general medical doctor. Until this point, doing PACEs, you are a general medical doctor.
Exactly.
You will never even order the pre-biological investigation. If nobody has told you this is the list, order it. فيعني don't put yourself under what we said responsibility which is not yours.
Mm-hmm. Exactly.
He asked, even if he asked, he might be a very bad surrogate or very educated surrogate. So tell him, okay, I understand how much you're worried about your dad, and يعني I can imagine how much it's difficult for you. Let me involve my seniors.
Yes.
If there is something missed, I apologize, and we will do our internal investigation and come back to you. That's it. يعني take it simple. يعني this
Yes.
is my advice. And the way Dr.
Yeah.
Bass said, don't assume. The best thing is not to assume. Is there is any investigation missing? Whether if they did this would be better than doing this.
Exactly.
Starting this is not true. If they didn't mention anything about the
And
prognosis.
it will sound, Dr. Hind, that you are not trusting your team and you are not trusting the scenario. If you
And
are
you're
assuming
wasting your time. Immediately,
exactly,
they will
yeah,
be
it's
angry that
yeah,
there will be some agenda written in their calibration. You
yeah,
didn't give it time, and you were jumping into things which was not included in the scenario.
yes,
This will make them irritated even more. And
yes,
you are pretending things, discussing them, and the surrogates still have some concerns, some calibration which was not
exactly,
fulfilled.
yeah. Even
And
he
they will
might be,
become more harsh in the evaluation.
yeah, and the surrogate will be more wondering why you are raising this issue. I don't have any instruction about it. Why you want to talk about it? So don't raise the things which is not written and not clearly explained in the scenario. Okay, go to the task, and you will have. Believe me, it's very nice concerns. It's not that much detailed concern. They will not go through all these details. They need from you to know how you are dealing and handling the communication scenario without any detailed information. Okay,
والكومنت اللي قالها دكتور باسم don't interrupt the surrogate actually ضربتني لإلي كمان. يعني
yeah,
بيكون قدامكم surrogate, his questions are very lengthy and he repeat the question multiple times. مثل ما الله خلقنا لازم نستنى. We have to wait until he finish. حتى لو we have a big agenda, believe
Exactly.
they will respect that you are listening more than respecting that you have been done with your agenda. يعني you will be happy that you are done with your agenda. هتلاقي that you lost your mark in the communication because you were not listening, and they forget that you fulfill your agenda. حتى they did not يعني even mention it, but they will mention that you didn't listen to the surrogate. فتry not to interrupt, especially if your surrogate is slow and repeating. Listen till the end, or even look at his eyes.
Yeah.
لحد ما وقفت حركة،
Yeah.
يعني
Then you
lips
can
are not
stop.
moving, then you start talking. لأنه بصراحة يعني قلت كومنت يعني بتكسر
Yeah.
الخاطر. We do
Exactly.
everything correctly, but they pick up something very minor, they cut your marks.
Imagine Dr. Hind, why I was interrupting her, because she was shouting and she's worried about her father. He has ICH, he is in coma now. What I said, I can see how much you're worried. That I appreciate your worry.
يعني
The
أنت
things
كنت عم بتقول لها كلمات تهدئة
yeah,
أثناء ما هي
not
معصبة.
interrupting by answering. I'm trying to calm her down, but they consider it as interrupting again. Anyway, the examiner always, they have their mind and
But
they have
thank
their,
you for telling this, إنه be careful.
yeah, they are.
Even
Yeah.
such a way of interruption is not
Yeah.
accepted in the exam.
Yes, it's not.
You should
They are
be
not accepted
silent.
till
تسمع
they
بس
stop.
يعني.
Till they stop. Now the time to answer. Before she stopped talking, they will consider
Never
interrupting here.
interruption.
Yes.
Yeah, okay, thank you.
Okay, most welcome, Dr. Sa. Thank you. It's a good experience, you and Dr. Hina, really. Any comment before ending the session? Yes, a good comment from RCP basis comment. What we need to trust the scenario as they mentioned, hepatitis B is negative. So yes, agree about this comment. 100% totally agree. Chronicity, Dr. Aisha mentioned, yes, there is chronicity, but again, the chronicity had another markers, so it's not written in the scenario. We will not assume is it chronic or no, but the chronicity will have another markers, which is not in this scenario.
They said it's cleared. Otherwise, they would say
Exactly. Yes,
he
I don't
remained
think.
chronic carrier. Actually, cleared is different from remaining chronic carrier. يعني it's
Exactly.
never mixed up. I don't think anyone will write a scenario who will mix up between chronic carrier and cleared. Cleared, it means
Yeah.
cleared.
And the
يعني
chronic will be a contraindicated to start. Chronic means there is still infection ongoing.
عليك نور. فيعني we can really be يعني we can be relieved إنه السيناريو was clear. تمام. يعني السيناريو at least sometimes when they copy the scenario we lose these good terms. هلا لا، حرام مكتوب good sentences in the scenario supporting the effort of the team. وشغلة تاني دكتور هنري, when you were answering doctor, I feel she was telling you it is a mistake. Avoid confrontation. What you said, it is not a mistake. This way of answering is a confrontation, which the examiner usually don't like. So don't say, I really, يعني, I can't imagine how much you are stressed. It is not a mistake. By saying this, just mention that your opinion, that we tried our best to explain, it's most likely to be a complication rather than a mistake, but don't immediately give the negative sentence of what the surrogate have mentioned, because they always insist, don't confront your surrogate, don't confront your patient. It is a mistake. No, it is not a mistake. Such a way of answering is a confrontation. So try to avoid it and use different way of expressing your opinion, not by يعني not by this way. This way is a confrontation. It's not acceptable in communication. Just like the last comment, because he said it is not a mistake.
Yeah. Thank you, Doctor. It's good comment. And I want to answer Dr. Salma. Is it important here or need to do summary? Don't summarize or sum up any scenario with medical error or angry patient or surrogate. It's not recommended. The patient will be more angry again and you'll be in trouble. You want to close the scenario and you irritate him again. Oh my God, it sounds like you opened the war again and you'll be in trouble. The examiner will not like this question. Okay, don't try to sum up or to ask patient, can you please recall what we have done today? It's a major mistake. Okay, Dr. Salma, clear? Yeah. Okay, thank you, Dr. Salma. Anyone want to add any question or comments? Clear. Okay, thank you, Dr. Henry, Dr. Sarah, and of course, Dr. Hind, for your precious time and precious information and comments, feedback. I've always updated, Dr. Hind. Thank you. Thank you, everyone, for the
والله
attendance.
الله يسلم ايديكم because it was a very nice. But I was reading now just for our knowledge. مثل ما انت قلت,
Yes.
if we confront a scenario, it's really good to read. يعني this is when we will learn something new.
Yeah.
Actually, she is right in her suspicion. Whenever there is a past history of hepatitis B, they prefer
should do.
a triple test. Anti-hepatitis B S antibody and anti-hepatitis B core to detect if there is
Perfect.
if there is a previous immunization clear, how it was clear.
Yes.
So they are calling it a triple test. تمام, not just a screen.
Yeah. So
That's why
let's
I
repeat them.
just
Yeah.
from the beginning I was just concerning its maybe uncertainty
Yes,
because
still
they are
I
just
will.
doing
Mhm.
S only, surface antigen only.
By the way, Dr. Sarah,
That's
we
why
didn't.
I couldn't
Yeah, but we
be
didn't answer
beside
you
my
as a
team.
clinical judgment. We answer you as a basis judgment.
عليك
Okay.
نور,
I
يعني
mean,
still
Yeah.
we are insisting on the way
Yeah.
we advise you to do.
How to
تمام?
do,
okay.
but not in clinical way. We are answering as a communication way. I will ask my senior. I will ask the team. I will investigate. I will, but don't say
Okay.
clearly, no, I don't know. They don't like the answer as I don't know. So you don't know, yes. And our answer sound that we don't know, but it's not a clear I don't know. We are talking about we have specialized team that who can answer this question properly. This is not our task or this is not our specialty to answer it clearly, okay? And back to yes, Dr. Hind, anything else you want to add? So the triple including
Triple
hepatitis
tests are,
service,
are better
BCOR,
whenever your case who will take a
yeah,
biological treatment have
yeah,
a past history of hepatitis B. So better to go through the triple test, antibody for
service,
S,
yes, and antigen
antigen
and core.
and
Yeah,
antigen
perfect.
triple test.
Yes, perfect. Okay. Thank you for the update, Dr. Hind. This is the benefit of listening to others. Anyone in the meeting, not only Dr. Hind, anyone have update about this information while discussing, he can update us or he can update in the WhatsApp group. Okay. Now we have this information clearly, even in the exam. But again, don't answer it as your responsibility. This question will be answered by the assigned team. If you know it, you can say it as an answer, but not as the in detailed one. Okay. Thank you again, everyone. So we'll see you tomorrow, inshallah, with the short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
So